Hello and good morning, everybody. Today we are starting this session to know more about thyroid. First of all, I want to introduce myself. I am Yogendra Yadav. I'm engineer by profession, but wellness coach by passion, and I'm into this industry for few years by now. So today our guest is Dr. Shakti Singh Devra. He is based out of Ahmedabad and he's working with a hospital in Ahmedabad with the name Northwest Cancer Hospital. He is a head and neck surgeon oncologist and he is also microvascular reconstructive surgeon. Priorly, he also worked with Narayana Hardulya Multi-Speciality Hospital based out of Ahmedabad. He is basically from Rajasthan and I hand over now to Dr. Shakti Singh for his opening remarks about no thyroid.
Thank you, Yogender, for a brief introduction, and thank you for inviting me on this program of a just awareness talk on the thyroid cancer, thyroid diseases, or you can talk about the various signs and symptoms of thyroid. So basically, I'm a head neck surgeon. So my role for the thyroid is limited to the cancers and benign and the tumors of the thyroid, whether it is a benign or it is a malignant. So before we talk about the tumors of thyroid, I think everyone should know what is a thyroid gland, what does it do in the body, what are the side effects, what are the symptoms I say of this thyroid gland, and how do the medical science manages these symptoms. Because it is important, we all need to understand that now it's not only the medicinal treatment which is important, we are working towards an integrative healthcare system in our country. So integrative healthcare system, it start always with the lifestyle changes, as as my friend Yogender said. So we are going to talk about how a lifestyle changes, uh, you know, uh, takes over many diseases, and you refrain from taking the medicines. So yes, we'll go ahead, Yogender.
Doctor, the first thing I want to know for all of benefit of all of us that what are the typical symptoms when our thyroid gland is either overfunctional or underfunctional? So, what are the typical symptoms one should know?
Okay, so now when we talk about the thyroid gland, so first I'll tell you where the thyroid gland is. Thyroid gland is basically situated in lower part of the neck. Okay, so this lower one third of the neck, it's a butterfly shaped gland which has got two wings, and central part is connected by something called as isthmus. No, so now these thyroid glands secrete something called as there are hormones are being secreted into the blood. This is one of the endocrine gland. So these hormones are released into the blood, which help in the normal functioning of many organs in the body. So these organs are specifically the heart, your skin, heart, and various other functioning, metabolism. So various things are monitored by this thyroid hormone. So the thyroid hormone, basically, grossly, if we say, there's something called as T3 thyroxine, T3, T4, and TSH. So thyroxine is one of the hormone which has been secreted by this gland. Now, it can be whether the increase in the production, that is hyperthyroidism, or decrease in the production, that is hypothyroidism. So normal value of the thyroxine, the TSH level are 0 to 5%. More than this levels, we consider that as a hyperparathyroidism. Less than this, we consider it as a hypoparathyroidism. Now we talk about the symptoms. Now these symptoms are basically the symptom for hyperparathyroidism are different, hypoparathyroidism different. So first talk about hypoparathyroidism, in which your thyroid levels are actually raised. So suppose if you go to a doctor, get your levels checked, and the thyroid levels are more than 15 or 50 or 100, that means you are hypothyroid. So basically your body has less thyroid. Not compare the value that if your value is down, you are hypothyroid. It is the other way. If your values are high, if your values are high, you are hypothyroid. So now the hypothyroid symptoms. Hypothyroid symptoms, if we talk about these hypothyroid symptoms, there are various symptoms. As I said, it helps in the general functioning of the body. So let's talk about some symptoms in the in the body for hypothyroidism. So the people feel a lot of tiredness. They have more sensitive to cold. They have constipation, dry skin, weight loss. There are many symptoms. So it is very difficult to pinpoint that this symptom is specifically because of the hypothyroid. A good physician, as I said, I am basically a head neck surgeon. We only treat the disease of thyroid when there's an enlargement or when there is a problem in the thyroid. We actually, who treats the disease of hypothyroidism? That is being treated by the general physician or the endocrinologist.
Correct.
So when we talk about the thyroid diseases or thyroid disease per se, is if you have all these symptoms, whenever a patient goes to a doctor, and a good physician will be able to make out whether it is because of thyroid or not. See, it is not the one symptom that if you have dry skin, it is because of thyroid. So it is the smartness of a good physician wherein they compile the symptoms or given by the patient, and they then try to arrive at a diagnosis. But when I say about now, suppose, as I said, there are many symptoms. You have a dry mouth, a dry skin, you have tiredness. So everything, these symptoms can be managed by changes in the lifestyle.
So, Doctor,
Not every symptom. Yeah.
so you said that most of our glands are very interrelated. The hormones secreted by one gland interface with the functioning of other gland, or I must say, is responsible for the smooth functioning of other glands. So, I think they are very closely interlinked. And
Perfect. Yeah, yeah.
as you said that a smart physician need to identify if the person's thyroid gland is functioning normally or abnormally, and based on that physician may ask you to go for the test like T3, T4, and TSH, and based on their values, usually a doctor suggests you medication like thyroxine or thyronome, and they suggest the dosage size, how many mcg of the tablet you have to pop up every morning. Right. So
Right.
my question is, if a person starts medication and doctor specifically says that you have to take the medication every day and till the last breath of your life, till the last day. So what is that we can do to prevent to reach to that condition?
So now, as I was talking about the hypothyroidism, now only medication which a medical science can give you an answer is the thyroxine supplement. That is basically a hormone supplement which is given by a doctor.
So you
Thyroxine
mean to
in the
say that
doses of.
what hormone is not made by our gland, we are basically giving that artificially from the outside?
Yeah, so this medication is specifically to supplement the thyroid hormone. Now, as you said, your all
So
glands are
I want to
interrelated.
interrupt you once more, that I want to understand from you, because you are the person who is dealing with thyroid gland day in, day out. For our benefit, please explain if giving this artificial thyroid to our body, is it the right step, or is it the correct solution? Is it the root cause, or it is just the symptom management?
Okay, so as I was coming to the point that you have already mentioned, the most of these glands are interrelated. So what's happening is when there's a decrease in the thyroid level, the message goes to the pituitary gland. From there, it is all interrelated. It's the physiology. I'm not going to get into details, but that gland gives a signal to the gland to produce more thyroid hormone. So what is happening is when the thyroid levels are low and body is not able to produce, we are just giving a supplement. But my point here is, if we can increase or if we can stimulate the production of thyroid by stimulating the gland, by changing the lifestyle, by using any other ways of medication, not only the medication, any other ways, like it can be any Ayurvedic treatment, homeopathic treatment, lifestyle changes. It can be naturopathy. There are various ways to stimulate the thyroid gland to produce the adequate hormone. If thyroid is producing adequate hormone, of course there's no need to take this external artificial hormone supplement in the body.
Correct. So to understand few things in more detail, that as you said, that at the initial stage when a person starts having this artificial hormone, if they start making small changes to their lifestyle, they are having adequate sleep, they are adequate, having good food, they are exercising, they are reducing their stress level, so they can actually reverse their thyroid conditions. So
Perfect.
what among all these causes you understand, which is the most common cause nowadays, which is the most pressing issue that triggers this thyroid abnormality?
It's stress, stress, and stress.
So you mean
The
that
most common reason.
yeah, so
Yeah,
like our elders or the previous generations also had this thyroid gland, but their thyroid
right.
gland was usually not behaving abnormally, because these were the people who were used to live happy, jolly, bubbly, and enjoying satisfying life. But nowadays, we people mostly living in metropolitan cities are prone to have a lot of stress, or I can say the stress has become the part of life. We have accepted it. So, are you suggesting that if we start working on our stress management, things may get better?
Of course, of course. And as I said, this is the only stress is one of the reason which is contributing for most of the problem in our body. The stress arising out of our lifestyle, and again, stress is a byproduct of a lifestyle. So stress out of your working stress, your family stress, your personal stress, people, there are various ways where people are getting stressed, and nobody is focusing on changing the lifestyle. Everyone wants quick results. If somebody's thyroid is low, they want कि मुझे ऐसा कुछ करो कि मुझे instantly मेरा correct हो जाए. Nobody wants to work on it, that if I have a low thyroid levels, I should work on my stress, I should work on my diet, I should work on my exercise, I should be changing my lifestyle to correct the thyroid. Nobody thinks of it. That is the sad thing which I feel. So I think you people, we all should work together, developing a healthy lifestyle to prevent these diseases. See, the diseases, medical science is probably 100-year-old medical sciences, but we are living since thousands of years. This thyroid gland has not come up in last 50, 100 years. This is there since our evolution. And yes, people had thyroid issues, but nobody was dying of thyroid. But now, because of the stress, because of all these things, the thyroid is functioning abnormally. That is resulting in various disorders in the body.
So, Doctor, I think you informed me that this will be a quick session, and we'll be doing these series of sessions to make people aware about lifestyle conditions. So, the last question of the day is, other than stress, how much important good food, adequate nutrition is important for our thyroid imbalancement or the health of our thyroid gland?
Okay, so now there's a very very good saying that your mind works on what you eat. The stress levels are actually decreased by your good food habits. Everything actually correlates. It's a cycle. Everything correlates with ultimately what you eat, what you become. That is what the saying is. So
Correct.
you need to have a very balanced diet. You need to have a good food. I think that actually reduces the stress factors, also correlated with the having good nutrition and good diet.
Correct. So, Doctor, thank you so much for sparing time for this session in your busy schedule. I understand you are very much occupied. You are a sought after
Thank you,
surgeon in
Yogandhar.
Ahmedabad, but we will not be leaving you just like that, for the benefit of the society. And I personally believe that we need to give back to the society. We need to make people aware about lifestyle management skills. And unfortunately, that is something which is not being taught in our schools, college, and university, other than professionals like doctors or MBBS or other institutes. So I'll be expecting you to be more frequent and educating people and sparing more time with us.
Yes, I would like to take more sessions. As before we log out, I just want to send this message that unfortunately, in the medical sciences also, the prevention aspect is not very much stressed and it's not been taught. As a doctor, we have been only been taught to treat the disease, and the less stress is given on preventing the disease. So whenever you go to a doctor, there are a handful of doctors who is going to talk about how to prevent. Majority of doctors, they will say you have a hypothyroid, take this tablet, my job is done. But somewhere we are, as a doctor, as a medical professional, yes, we are missing that link of educating the people towards preventing the diseases.
So when you say that there is some gap between the uh, allopathy and the fraternity which is working behind that, and people who are looking for the solution, because every good doctor says that start working on your lifestyle. The pill for every ill is not the solution. So that is the time when I realize that people like you and me can make difference to this whole world and the humanity at a large. So with this note, I'm signing out off, and I'll be
Thank you.
expecting that we'll be talking more and we'll be educating people more. Thank you so much. It was a
Thank you.
wonderful
Thank you
time.
so much, Yogandar. Thank you for inviting me.
Bye. Take care.
Bye bye.